in your class today. Being able to attend this class, a couple of times each time it's offered is one of my favorite things to do. So I always look forward to it. So today I wanted to talk to you all a little bit about ethics and technology. Since we have roughly an hour and 20 minutes together, it actually would be nice for me to know who's actually here. So I was wondering if we can just quickly go through the room and everyone can just tell me a little bit about yourself. I don't need your life story, not your autobiography, not your secret crush that, turned into something else. But what I'd love to hear from you is your name, maybe your program of study, if you have a research interest. And what I'd also like to hear from you, no pressure, is what do you think is the most pressing issue when it comes to ethics in healthcare? So who would like to go first? No pressure.
Somebody should unmute. There we go.
I can go ahead. Hi, I'm Scott. I'm in my final year of computing science here at the university. And I guess not research, but my main interest in computing science is distributed systems and like cloud computing. And to answer your question, it's something that just came out off the top of my head. I don't know if I would say that it's the most pressing ethical issue in medicine, but when I have worked at internships or just in general, applications nowadays is really oriented around data, and the many things we build are very data driven. And so I think medicine is one of those things where aggregating large amount of data and using it efficiently can bring good benefits. But as we know, there are many ethical issues around collecting data, how we use data, and then a lot of ethical issues kind of in discussion about these new language models and all types of artificial intelligence that really rely on the underlying data that's trained on. So I think that's something interesting to think about.
Perfect. Thank you so much, Scott. And thank you for being the person to go first. If I was allowed to award marks for this class, I would immediately say you deserve like a huge bonus for what it's worth.
Yep.
And it sounds like one person has a reason they don't have to go first because they're sanguinating from their nose. So that makes sense. They're off the hook. Pram, you want to go?
Yeah, thank you. So my name is Pram. I'm in my third year of a Bachelor of Science degree in psychology. And in terms of like research interests for this course specifically, I'd like to look at brain-machine interfaces as well as osseointegration of robotic limbs and kind of how that can play a role in assistive technologies for people with disabilities. And I just talked to Dr. Solaz about this. So and in terms of ethical issues, one thing that I think is an issue would be conducting clinical trials on children, for example, with vaccinations. I think because we usually do clinical trials on adults, and especially in the past, it's been with adult males. A lot of the data doesn't really extend to youth. So I think that's probably something I'm interested in terms of healthcare ethics.
Thanks, Pam. It's nice to meet you. Ziad?
Okay. Yes, I can tap into this. I'm just connected to my headset. Can you guys hear me okay?
Yeah.
Okay, great. So I'm Ziad. I'm in my 5th year of my bio degree. And I've actually done a little bit of reading about healthcare ethics in a previous class. And one of the pieces that I wrote about was how a growing ethical consideration nowadays is the issue of conscientious refusals. So It's this idea, for anyone who doesn't know, about doctors refusing a particular treatment because it might infringe on their personal morals. And as a doctor, obviously, you ought to do what is best for the patient and maximize, the benefit to the patient. But if a certain treatment or if a certain practice kind of goes against your own personal morals or religious beliefs or whatever it is, there, you know, some people believe that there should be room for you to conscientiously refuse as long as there's certain criteria that are met. For example, if I'm like fundamentally against abortion, I can conscientiously refuse to, facilitate an abortion, but I should be able to refer them to someone quickly and effectively who will be able to do that for them. Make sure that the distance to them won't cause them harm, like things like that. So I think that one was an interesting one to read about because, when we try to maximize the best outcomes, but it infringes on our own moral rules and duties, it can create issues because all of a sudden everyone that comes out of medical school is like trained to think a certain way. And if conscientious refusals are completely prohibited, then all of a sudden you just have an army of doctor robots who can't really think critically and morally. Whereas on the flip side, if we allow too many conscientious refusals, patients will go untreated and uncared for. So yeah, just from my limited reading, I'd say that one is a pretty big ethical issue, especially in our world today, where a lot more conversations are being had about how we should respect everyone's beliefs and where they come from, and it's not up to you to determine how a person should think or act. So when those types of conversations are creeping more and more into like public discourse, I think it makes the idea of conscientious refusals a lot more interesting and heated now than it might have been in the past. So yeah, that's one that I think is a pretty major one.
Thanks, Ziad. And who else is there? Let me just see. I think, was that everyone, or did we miss someone? I think Kara Heel has a bloody nose right now, so
Right,
that
right,
totally makes
yeah.
sense.
Yeah.
Okay. And oh my goodness, it looks like I'm living in 2022, so my apologies. I need to be thinking in 2023. So I'll change the slide before I send them out to you. I'm a physician. I practice in newborn intensive care. So it means that I'm on a day-to-day basis involved in the care of babies and their families. A lot of the ethical situations that I witness are those that happen around the beginning of life. So when parents are confronted with new diagnoses and we're wondering how to approach those diagnoses from a medical care perspective. When babies are born extremely premature and we wonder how much intervention is justified or appropriate to use. When we're dealing with families after those babies have been born and there's a disagreement amongst healthcare providers and families, or even between healthcare providers about what is morally okay to do in this situation. These are the kind of ethical issues that we encounter in my world. But if we look more fundamentally at it, a lot of the ethical issues that we encounter are actually before we even get to ethical dilemmas or ethical decision-making. So when Pram, you were talking about, developing technologies for individuals with disabilities. Well, how do we frame an understanding of disability in the long term? In medicine, we tend to generally view it as an outcome, particularly in the NICU, as an adverse outcome. Well, what does that say for the life of an individual who has a disability, right? What does it say to their life meaning and their life value, right? When Ziad was talking about conscientious objection, how do you cope with a situation where, there isn't just another NICU across the street that you can send a baby, right? So it's one thing if a family doctor doesn't agree with treatment, they can refer to someone else within the Edmonton zone. But when you work in quite a specialized unit and there is no opportunity to refer, what do your ethical obligations change, right? So from that kind of clinical career in ethics, I also became interested in ethics from a research perspective. And so I direct the John Doster Health Ethics Center here on campus. And that's the link. We do workshops in the year, we do seminars, a whole bunch of stuff. If you're interested in getting involved, joining our mailing list, just go on the website. And if you're ever interested in attending any of our events, please feel free to reach out to me as well. These are the kind of questions I'd like to just begin by asking, recognizing that your own answers might be quite personal and may differ from mine. I'm not the authoritative source on what is ethics. Ethics exists as a discipline quite simply because there aren't any authoritative sources, right? Ultimately, there are different understandings of ethics. There's different understandings of what are right ways of proceeding. In different cultures, there's different practices that are understood as ethical, right? And we see ethics change over the course of our lifetime, right? If you look across the border and what's happening in the States, right, around abortion laws, right? You know, at what point can governments rewrite certain standards or claims or other understandings of morality? These are all ethical questions. So what I hope to do is share my understanding of the meaning of ethics with you, but I'm also very comfortable with you challenging me or bringing out a different understanding of the meaning of ethics. I would encourage you over our hour together to reflect on what do you see as significant ethical questions, not just for medicine right now, but the future of medicine, 10 years from now, 20 years from now, 50 years from now, right? How do ethics of technology relate to the ethics of medicine, right? So the medical ethics or health ethics literature is quite mature, you could say, around topics such as autonomy, around topics such as conscientious objection or refusal, issues around justice. But when you start bringing in new technologies, does that shift or change the way we understand certain ethical ideas? So does the nature of privacy change as we now have different ways of sharing our data, right? Do we need to relook at core concepts within ethics? Do we anticipate the qualities that exemplify or what makes particular healthcare practitioners to change over time? So is an ethical doctor nowadays going to be the same as an ethical doctor 10 years from now, right? And of course, we always need to ask, what is the role of ethics in clinical practice? Because we're not just interested in reflecting in a classroom environment. Generally, we're interested in bringing back any academia or reflections or understandings or research into the real world, right? These are the points that I wanted to bring forward from this lecture. So ethics is always already present in our day-to-day interactions, and then I'll go through the others as well. For some portions of today, we're going to focus mainly on traditional systems of ethics, because you have to have that foundation, I think, to reflect on how things might change, meaning you have to know where you are to know where you might be going, right? For the class that we have together on Thursday this week, I believe, we'll spend a little bit more time talking about technologies. So I'll start off with a case, and part of the reason I asked you all, you know, what do you see as, you know, major issues in ethics nowadays, is for me, this is an issue that's unfolding in the course of my workplace right now. And it's causing an ongoing stir about how do we negotiate such situations, right? So this is a case from this article, Cardiac Surgery for Children with Trisomies 13 and 18. Where are we now? So I'll read it out to you and hopefully supplement any kind of medical lingo with understanding that you can all get. So during their first pregnancy, Simone and Gregory Ultrabach were told the first trimester screen was abnormal. So when you're an expectant parent in Alberta, many places in the world, you get ultrasounds done or other kind of screening tests done to try and figure out, are there possibly complications in your pregnancy. And one of the so-called complications, or things that we screen for, are genetic differences in the fetus. All right. This isn't a true amniocentesis in the sense of a genetic testing, but it's rather looking at different markers on ultrasound or other blood work to say that someone is at increased risk. The diagnosis of trisomy 18 was made at 15 weeks after an amniocentesis. So this is a genetic test that's done, right? So a needle is put through a woman's belly and sampling is taken of the fetus, right? To basically make a genetic diagnosis. Trisomy 18 means this baby has a genetic difference. They have an extra 18th chromosome, and we'll talk about what that means. The couple decided to continue the pregnancy and name their unborn son Daniel, right? So in Alberta, currently, you never know in Alberta, right? If you follow the politics, people have the decision about whether to continue pregnancies or not before they're at least 20 weeks along, right? They can discontinue a pregnancy, terminate the pregnancy, abort the fetus. All of these different language or phrases I'm using have different kind of moral sentiments towards whether that's a good or a bad thing based on their preference, meaning they simply don't want to be pregnant, or based on a medical finding. And a medical finding like trisomy 18 is a reason that many parents do decide to discontinue a pregnancy. The bad news continued coming after every appointment, right? And I like the way this is written because, you know, the parents named their son, right? So that expresses something. But the way it's also written is that this was bad news, that their child had a diagnosis of trisomy 18. So Daniel had esophageal atresia, club feet, and the latest heart ultrasound revealed a severe form of hypoplastic left heart syndrome. Now at 31 weeks gestation, Daniel only weighs 900 grams, showing no growth in the past 2 weeks. So I can tell you at 31 weeks, this is a small baby, right? So it's not growing well. And what we know is that babies who are born with trisomy 18, they grow differently than babies who are born without trisomy 18. And then I completely glanced over these different medical diagnoses. So what are they? Oh, I put it here. So here's a picture of esophageal atresia. Esophageal atresia means that when you were forming, right, as a baby, right, your esophagus is interrupted, right? So normally food goes in your mouth, right? You swallow it, it goes down your esophagus into your tummy. But in esophageal atresia, the esophagus is blind ending. Food can't get down there, right? And instead what happens in development is your trachea, which is your big airway structure, has a connection, a fistulous connection with the esophagus, right? So what does it mean? This is a condition that's incompatible with life, right? So a baby who has this and it's not surgically corrected, they can't live without some kind of medical technology. Surgeons are able to generally repair this fairly easily in the first weeks of life. And essentially they ligate or cut this fistula and reconnect the esophagus, right? But it's a surgery. This is hypoplastic left heart syndrome. What does this mean? So going back to, you know, basic anatomy, right? So heart is in your body, in your veins, and it comes back into the right atrium, right? Atria means waiting, a waiting chamber. So blood goes into the waiting chamber of the heart and then flows into the right ventricle. It's then pumped out a big blood vessel called your pulmonary artery into your lungs, where the blood gets rich with oxygen. Then the blood comes back through the pulmonary veins, which are depicted here, to the left atrium. But in hypoplastic left heart syndrome, the blood can't get from the left atrium into the left ventricle to be pumped to the body, because that ventricle is hypoplastic or underformed, all right? This condition is also not compatible with life. Fortunately, when babies are in the womb, before they're born, they have something called a PDA, or patent ductus arteriosus, which you can think of as an extra blood vessel, which allows blood to bypass the lungs and go to the body. Because when you're in the womb, you're not breathing air, right? Because you're getting all your nutrition from the placenta. This blood vessel being open means that some blood flow can get to the lungs after birth. But over time, this channel will close on its own unless some kind of a surgery is done. A surgery can be done to essentially install like a plastic shunt from this right ventricle into the blood vessels, into the aorta, right? And then a series of other surgeries can be done over time. But these are big surgeries, right? And generally, they can't be done in babies who only weigh 900 grams. Okay. Does that give you a rough sense of that? Okay. So what I'm doing is I'm describing a baby that has a genetic difference and two major health conditions. So what is this genetic difference I'm referring to? So trisomy 18 is not that uncommon. Most of you will probably not have friends who have had a child with trisomy 18. Most of you look pretty young that you probably aren't thinking about having kids yet, but maybe I'm wrong. My apologies if I'm being judgmental. But it's still common enough that at any given time in Edmonton, we usually know there's at least a few mothers who are expecting a baby with trisomy 18 who've decided to continue their pregnancy, right? Most babies who have trisomy 18 have other kind of medical issues that go along with the syndrome, right? So here I'm talking about heart defects, limb abnormalities, differences with regards to how their brains formed, gastrointestinal anomalies as well. If you were a medical student, you'd be expected to memorize something like this. What are all of the features of trisomy 18? And as a medical profession, this is how we tend to think about this condition. As a genetic difference that's associated with a whole constellation of different kind of medical issues, many of which without intervention are not compatible with life. Some of which, if they're severe enough, we don't have an intervention for. So some of these babies simply just won't remember to breathe on their own, and we don't have a treatment for that. Right? Some of them, their bowels won't contract in a way steady enough that they can tolerate nutrition, for example. Right? But we also know that some of these babies, if you start doing medical intervention, can survive, right? And this is how often parents think about their children who have trisomy 18. They don't think about them as having esophageal atresia, club feet, hypoplastic left heart syndrome, and so forth. Their child is someone who has a name, right? They're someone who grows up and changes over time. Now, these children tend to have a different life, right? So in the long term, many of them who do survive, right, and the minority survive, do not develop past like an age of, you could say, 6 to 12 months of age developmentally, right? So they might not ever have words that they can say out loud, right? They may not ever be able to walk and be dependent on some kind of an assistive technology, right? They may be dependent on a feeding tube, you know, through their nose or surgically put in through their belly for their nutrition. So they have a very different kind of life, right? They have a different grasp potentially of the world. But they can have a meaningful life in the sense of, it seems that they can experience moments of joy, right? They can laugh, right? You see some of the kids in these pictures, they don't appear like they're suffering, right? But on the other hand, to deal with some of their medical conditions does involve pain, technologies, surgeries, and so forth, right? So why do I say that this is such a pressing issue in my world and actually in healthcare? Is it speaks to the situation that we're now in. Much of our healthcare spending and our healthcare resources are used for a relatively small segment of the population or the broader population at a particular time in their life, right? What do I mean by that? Most people, if they're going to be accessing a lot of healthcare, they don't do so until the final years of their life, right? or they tend up using a lot of healthcare resources if they have various medical complexities and other issues, which presents a potential ethical issue or an issue around justice, right? Is this fair, right? That, you know what, we use up an ICU bed for a year to try and keep a child alive, knowing that they may only live until they're 3 or 5 years of age, right? Is it fair that, you know, when it comes to hospital beds, that people use up so much resources in the last 6 to 12 months of their age, right? And that takes away from others. But there's also the ethical issues with regards to, well, how do we understand what these children's lives are like, right? We don't want to cause suffering in a baby just because their parents can't let them go, right? How much medical intervention is too much medical intervention? Are we happy supporting lives that are going to be very different from our own, right? Most of us aren't dependent on these kind of medical technologies for our life. So the issue of medical complexity and how much should we do as a society for children, adults, and so forth, is one of the perennial topics in healthcare, right? And why it's a particular issue in Canada compared to other places in the world is because we have a public healthcare system, right? So many children with trisomy 18 don't survive in the United States because their parents can't afford them, if that makes sense, right? On the other hand, in parts of the United States now, parents are no longer afforded to make decisions about ending their pregnancy if they have a diagnosis like this, because their autonomy as a woman is no longer being respected, right? Which means then they're forced to have a child like this, but the state isn't going to necessarily pay for it, right? Does that make sense? Yeah. I'm trying to give you a texture of this because, you know, medical ethics, if this is something that interests you, it's extremely complex, right? And medical ethics from a, how would I put this best? From like a discipline perspective, it's not like other disciplines where it's meant to just come up with an answer. It's rather often trying to show the complexity of the situations that we're confronted with. So if we're talking about ethics and conscientious objection, well, we could talk for hours about that, right? Because there's so many different ways of looking at that situation. If we're talking about ethics and ableism, or changing the bodies of individuals with disabilities to conform to what we view to be normal, right? So reflecting a normative bias. Well, again, we could talk for hours about that from different perspectives, right? Talking about data, right? What is data, right? Who decides how data is objectified, right? You know, often how we objectify data or how we collect data also reflects certain biases. So even if the algorithm is correct, our original way of abstracting data for something like machine learning may be fraught by biases as well. Okay. So, man, I'm going to go way over time. I promise I won't. I promise I won't, because we can just put it into Thursday if needs be. Any questions so far? So my goal initially was to give you a sense of ethics. And now I want to talk about, well, what is ethics? So I can leave you with some kind of definition or understanding. So how I understand ethics as a discipline after doing a lot of study, a lot of reading, looking at different people's understanding is ethics is a discipline which deals with or responds to something other than ourselves. Right? So ethical questions are generally those that arise when we have to think about how our own actions are going to affect someone else, right? If I go, you know, really simple example, I go into the freezer and I see there a pail of ice cream there and I open it up and I'm the only one who lives there. It's not an ethical decision, should I eat all the ice cream up? But if I have 2 kids who are in my house, my kids, and I eat the last of the ice cream without sharing it with them, then that becomes an ethical situation, right? Because my behavior affects someone other than me. But what's interesting about ethics is we have to acknowledge that those other individuals whom we interact with on a day-to-day basis often have a different subjective grasping of the world. Subjective, I don't just mean, oh, it's subjective in the sense of not very precise, but rather that different people have different bodies. They have different bodily capabilities. They grow up in different cultures. They have different senses of the world, right? Take a baby, for example, right? You know, how does a baby grasp the world? Right? Have you ever thought of that? Like, does a baby differentiate self between other? Do they have a sense of reflective consciousness where they can weigh what's right and what's wrong? I mean, it's a very interesting kind of philosophical question, and we don't have time to get into it today, but there's a whole bunch of literature that points to the fact that although we've all been babies, right? We've all been babies at one point in our life. As babies, we actually grasp the world in a very different way than how we do as an adult, right? How do people grasp the world when they're dealing with illness, right? When someone has Alzheimer's, for example, what is their sense of time like? Their sense of choice like? How do we deal with these situations? These are ethical questions. What if we're no longer talking about people, but say we're talking about animals, right? The notion of animal ethics exists because we recognize that animals potentially have a sense of self that's other to our own, right? Even if they're developed very differently, if they have different developmental capabilities. We can talk about environmental ethics, right? Why? Because we review the land in which we live as something other to ourselves. It's not simply there as a resource for us to call because, you know what, I want to build a house there, right? Or I want to build a highway there, right? There's an ethics involved because our choices affect someone who's other than me. Does that make sense? So what is ethics? Ethics is founded in a concern for whom or what is other to ourselves, right? Emmanuel Levinas is one of my favorite French philosophers. He says, ethics is an optics. So in other words, it's a way of seeing. It's a vision without image, meaning it's a way of seeing where we're not so much confronted with an image that we can conceptualize or abstract. It's bereft of the synoptic and totalizing, objectifying virtues of vision. It's a relation of an intentionality of a wholly different type, right? So for Levinas, ethics arrive precisely when we're confronted with a situation of someone other than ourselves. But we also know ethics has to do with notions of good and bad, right? So Wittgenstein in his lecture on ethics writes about ethics as the inquiry into what is really valuable or into what is really important. The inquiry into the meaning of life or into what makes life worth living or into the right way of living. Okay. So you and I can have different moral beliefs, right? Because we've all been brought up with, you know, different life circumstances, right? With different parents or other individuals who've cared for us in our life, right? And some of us might hold certain values very near and dear to us because of our own sociocultural past in area in which we live, right? So the proto-ethical question asks, what is going on to which I must now respond? So in healthcare, we find ourselves in situations where we're dealing with people other than ourselves. And most commonly, who we think about is the patient, right? So patients generally don't get to choose who is going to be their doctor when they come into the emergency department sick, right? They don't get to choose who's going to be their doctor when they have a baby born extremely premature, right? So it doesn't make sense that my own personal values wholly inform how I should act as a healthcare provider, right? Rather, I act according to certain societal expectations. But I also regard that ultimately I'm acting for the good of someone who's other than myself, which is hopefully that patient, right? Who I hold first and foremost in my mind. That's like this cardinal notion of respect for autonomy for the patient. So the basic ethical question that I need to ask is, well, what's going on for them, right? How might they be experiencing this particular situation? And often the best way to arrive at ethical decisions in healthcare is to talk to patients, right? That's what we do. We engage in shared decision making, right? So the perception that I'm trying to communicate of ethics is very different than how ethics is often taught in a philosophy class, right? In a philosophy class, you might be taught about something like the trolley problem, right? So the trolley problem, the idea is that you have a trolley going down the tracks, right? Here you are, Scott. You're standing there holding on to this lever, right? I don't know how you got there, but you're holding on to the lever and the trolley's coming down. If you do nothing, the trolley is going to run over these 5 individuals who have been chained to the track. If you pull the lever, if you implicate yourself into the situation, you can save these 5 people's lives. But you're going to sacrifice this one, right? What's the right thing to do, right? And you can come up with different ways of reasoning through this, and we can talk about ways of reasoning through this. But how ethics actually unfolds in healthcare is so much more complicated than this, right? It's not just little stick figures, right? We're dealing with people, right? We're dealing with potential biases, right? And actually, what I would say probably first and foremost is that we're dealing with technologies, because most ethical decisions in healthcare involve some kind of questioning about the utilization of a technology. So there are some philosophers of technology who actually say that all ethical decisions are technological decisions. All right, let's keep on going from here. So the notion of moral consciousness. So we talked a little bit about how something may resonate with you as being good or being bad, right? As a consequence of how you were brought up. And we can use the phrase moral experience to describe a person's sense that the values that he or she deems important are being realized or thwarted in everyday life. So if you're in a situation where you feel that, you know what, people are acting according to the values that I think are important, values like being honest, maybe values like being compassionate, being caregiving, right? Then you're going to feel within yourself that, you know what, my values are being realized. So from my sense making, this is a good situation, right? And that reflects often the values that you were taught growing up, right? And what you saw growing up, right? The culture in which you're born. But culture changes, right? So take a snapshot back to the 1960s, the beginning of neonatology, my discipline, right? So this is where I work. In the 1960s, if I was practicing as a neonatologist, oh, never mind, this is the 1940s. Sorry, neonatology came up as a term in the 1960s. But if you actually want to know about our history as neonatologists of caring for premature infants, part of our history is actually taking little babies and putting them on display in a fair, right? Which is kind of a weird thing to do, right? Here you have these little babies who are born so vulnerable, right? So immature. And what are we doing? We're making money off of them, right? We're putting them on display in these primitive incubators, right? And this is picture from the New York World's Fair from 1939 to 1940, right? This was somehow deemed to be an okay or a good thing to do back then. If I were to take a parent's newborn baby now and say, you know what, they're born too small, they can't survive, but you know what, if you let me take them to a fair, maybe they'll have a chance of surviving because I can put them in this miracle machine. Well, does that sit with you as being morally okay nowadays? I imagine probably not, right? So my reason for showing you this example is not just to show you interesting pictures of the history of neonatology. It's to point to this understanding of ethics as being, in some sense, sociocultural, right? Meaning ethics is the moral atmosphere of a people or community. And our people or our communities may change over time. And we may find ourselves in situations where one or more community lives alongside another with very different moral values. Any questions about that? All right.